So I've been fortunate to work on a number of environmental health issues during my education here at Duke in North Carolina and abroad. And as I studied questions and problems of human poverty and the environment, it became clear that environmental health is a key variable for understanding the bidirectional or give and take relationship between quality of the environment and quality of life. As demonstrated in this photo, the operators of these water carts lined up for hours to get water from the only working well in this area in the Rift Valley of Ethiopia. And like many rural and poor households, they commit huge proportions of their resources to obtaining subsistence needs with significant health impacts. So I'm motivated to study environmental health because of the deep importance for the world's poor. Environmental health conditions are particularly critical because they indicate how the poor have limited forms of capital to fall back on in the case of environmental shocks or strains, including acute illness or crop failure. And we can imagine the interplay of health and the environment through unimproved traditional cook stoves, unmaintained drainage, and the food supply, dictating key outcomes for the health of people around the world. For this project, prior work by Professor Avner Van Gogh and a postdoctoral fellow, Teddy Rango, contributed to the growing understanding of the problem of naturally occurring groundwater contamination in the Rift Valley of Ethiopia, including arsenic, but particularly fluoride. And as we know, fluoride at low levels is beneficial for dental health, but at even moderate levels can be quite detrimental, resulting in the malformation of tooth enamel and which results in tooth decay. And at higher levels of exposure can even damage the skeletal system in the form of skeletal fluorosis. So recognizing the interdisciplinary nature of this problem, particularly when set in the broader context of the agrarian subsistence population in the Rift Valley, Dr. Van Gogh recruited medical and social scientists to form a team to conduct a broader study on water and health in the Rift Valley. And so I got to be part of that team. With a larger and randomized sample, we're better able to characterize environmental health risks, including fluorosis incidents. The broader project also incorporates the important component of climate change, which of course affects water supply. And the Rift Valley, in this case, is predicted to face severe and permanent climate change to hotter and drier conditions. So by understanding household dependence on their water supplies, we can evaluate the potential impacts of climate change and the adaptive behaviors households might take. And we also want to identify factors such as knowledge or local institutions which are correlated with improved environmental health outcomes that might be able to take the form of interventions. So in a pilot study last year, I spent a little over a month in Ethiopia. We conducted household surveys and health exams in 20 villages in the Zawai Shala Basin in the Rift Valley, and there's a map outside on my poster. We had a team of 5 surveyors and 5 trained nurses, and we visited houses that we randomly selected from a central point, usually the well. And we conducted extensive household survey, and the nurses did health exams and detailed oral exams. And in the period of a little over a month, myself and a woman from the Nicholas Institute of Environmental Health Solutions, Courtney, completed 1,094 health exams in 399 households, visiting 1 village a day. So our findings in this larger sample confirm that fluorosis is a significant environmental health threat, with about 50% of our sample having signs of dental fluorosis. And the data, however, and importantly, suggests that information ability may alter the household's behavior, because we found a weakly significant effect of knowing about fluorosis correlated with improved dental outcomes. And so we're trying to determine the mechanisms, but some households reported getting water from distant water supplies just to try to get safer water. In addition, a result that Teddy had previously found was that milk intake is correlated with reduced fluorosis. And so in our regressions, we also find that for each additional time that an individual drinks milk, they have approximately 10% better dental outcomes controlling for other factors. So also interesting is that the majority of households expect climate change in hotter and drier conditions, which is consistent with predictions. And part of that is information, and part of that is also their experience. And crop failure is a real concern, and half of our sample had more than 2 complete crop failures in the previous 10 years. Professors Erica Weinthal, Mark Julin, and Mark Belmar have recently received a grant that I'm part of from USAID to examine the mechanisms by which households process information about the risk and uncertainty regarding water supplies. And so I'm going back to Ethiopia again in January and again in 2014. So I'll get the chance to be there through 3 harvest seasons. And I'm hoping that the additional data collection in this project will allow us to identify potential interventions that might help communities in the Rift Valley and other arid communities improve environmental health outcomes. So in my own dissertation, I hope to evaluate in more detail how the households make these decisions about environmental health in a social context, how they receive and process information, their preferences of risk and ambiguity, and how that risk is mitigated through community features, through social capital. So again, I want to thank DGHI, the Graduate School, and the Nicholas School, and my advisors, Mark Jewell and Erica Weinthal, Randy Kramer, and Mario and Miranda, the team that I'm part of, and our collaborators in Ethiopia.
Questions or comments for Chris?
Yeah.
I think it's a good presentation. You talked about households as sort of your unit of analysis, but we know that households have a lot of inequalities within them. And I was wondering if you could just talk about particularly some of the disparities with regards to gender and the burden that's borne differently by men or women in a household because of these environmental impacts.
Yeah, that's a great question, and one that's a challenging one for social science researchers, partially because we want to be able to collect information across large groups of communities, but of course the individuals are making a lot of really important decisions about their health. And in our sample, I think many of you won't be surprised, the people who fetch the water are the young and primarily women. And so the wells that we study are really important because even though they're contaminated frequently with these inorganic contaminants, they're much closer to the town, so they require a lot less travel time. And for male and female children, both households want their children to be in school as much as possible. I think that the household is probably a useful way to think about this environmental health problem with regards to water, because the household is sharing their water supplies and they're sharing the information about it. And so in terms of the decision making, I think it happens at the household level. But there definitely are disparate effects in terms of gathering water, and it makes the policy questions surrounding the installation of wells, deep water borehole wells like the ones that are contaminated, much more complicated because they might improve outcomes for families in terms of time spent collecting water, but they could have serious health outcomes from exposure to fluoride or arsenic. Great question. We're trying to consider this in relation to our project, because we'd like to think about even testing interventions that might improve health outcomes related to water. So milk is generated at the household level by cows and sheep that people keep in their homes, and most families that we visited had cows. I don't think there's a huge market for milk, and so whether or not a household has milk to consume is determined strictly about whether or not they actually have those animals. And it does change throughout the year, and of course the animals are also seriously affected by climatic shifts and droughts and such as that. There is a project with a group that we're in touch with at Oklahoma State University that's working on treatment options, but fluoride is a difficult element to treat water for, and so it's particularly difficult in these rural, hard-to-reach sites. So the main option that households have is to go to alternate water sources, and some households told us that they would send their children once a week to seek drinking water from the town, which is known to have lower fluoride, and they would try to use the other water only for their animals and for washing and such as that.
Chris, can you elaborate on what you said about perceptions of these households and climate change? And did you ask any questions about information sources about climate change?
So we didn't ask directly about where households get their information about climate change. And I think that is an important one because there's the relatively limited access to the media. We ask about access to radio and television, relatively limited access to media, but households are clearly aware that the climate is changing. So I think it's an important thing to address about sort of the endogeneity of that or exogeneity of that information, where that information is coming from. But we have a long setup in the survey about perceptions of changes over the prior 10 years, and then expectations over the future 10 years with regards to seasonal change. And so one of the neat things we're doing with Wen-Hong Lee, a professor in the Nicholas School, is looking at climatic models in the future, and we can resolve it to the 3-kilometer grid cell, so essentially the size of these communities we're working in, and so we can compare the expectations and the predictions of the communities to the IPCC, the International Panel on Climate Change, Intergovernmental Panel on Climate Change models for climate for that particular locale, and get a sense about whether or not expectations line up. And that's obviously information that isn't distributed to the community on that scale, so that it may be that will tell us a little bit about the variation in knowledge of climate change.